Hi, I'm Dr. Emily Gosda here with Crazy Mountain Veterinary Service. Today we're going to talk about ionophore toxicity in large animals. So ionophores are a class of antibiotics that are commonly added to bovine feed supplements to promote feed efficiency and growth. These products are also used to reduce and control coccidia in cattle. You might recognize these products by their brand names, Rumensin, which contains monensin, and Bovatec, which contains lacillocid. Although these are pretty useful ingredients to add to feed in ruminants, when they're fed at too high a level, they can become deadly for cattle, sheep, and goats. Of even greater concern, however, is the risk these feed additives pose to horses. Horses should never be given access to anything containing Rumensin or Bovatec because consumption of these products can cause an array of severe diseases, ranging from sudden death to chronic heart damage that progresses to heart failure over months or even years after exposure. When consumed at toxic levels, ionophores cause direct damage to the muscle cells of the heart, as well as skeletal muscle and smooth muscle that lines internal organs. This can lead to signs of colic, muscle weakness, abnormal gait, neurologic disease, and heart disease or heart failure. Consuming as little as 50 milligrams can result in death within 48 hours of exposure in normal-sized adult horses. We're here today with our client Megan and two of her horses that were exposed to Rumensin about 30 days ago. These are 2 out of a group of 6 horses that unfortunately got into a supplement containing Rumensin designed to be fed to cattle. We're about to perform cardiac evaluations on these horses to ensure that their hearts are functioning normally so they can be safely ridden without risk of sudden collapse from cardiac damage sustained from exposure to Rumensin. We have our client Megan here who owns these horses. These are 2 out of a group of 6 that were exposed about a month ago, and we're just gonna kind of discuss what that experience was like. So, Megan, how did these horses get exposed to Rumensin in the first place?
So a gate was left open in our barn, and they were able to get access to where the feed was stored, and they actually pulled it through some panels
Oh my gosh.
to have a little snack.
And what kind of feed was it?
It was the Bull Challenger pellets that had some rumensin in them, and it was actually the only bag that we had left.
Wow.
So,
How much do you think they ate between the 6 horses?
there was about a quarter of a bag left, so I'm hopeful that they kind of split it evenly, but I'm not really sure.
Yeah. So like we thought maybe 25 to 30 pounds
total,
roughly
yeah,
total
between the 6 of
horses.
them, yeah.
Okay. So what did you do whenever you saw the horses in the Rumensin feed?
We immediately loaded all of them up and brought them directly to the vet.
Yeah.
Because we knew that it was not a good thing.
Right.
So.
Not a good thing at all. So once Megan we brought 5 of the 6 horses in. There was one that we did not see next to the feed with Rumensin, so that horse did not come to us, but all 5 horses were tubed multiple times over the course of 24 hours with mineral oil and charcoal, which is the best course of treatment, especially early after consumption. We can kind of prevent the absorption of some of the Rumensin in the digestive system that way. Horses were also put on fluids for the first 12 hours, so they all were given IV catheters, set up in Megan's barn for IV fluid administration. We gave a couple other medications, including vitamin E and selenium, Banamine, and they had to be very closely monitored for the first couple days, really. We have to monitor their heart rate and rhythm very closely during that time. If there's any changes in heart function, then that automatically puts those horses at a way higher risk for permanent cardiac damage or death. Luckily, these 2 horses and the other 3 that came in to see us did not show any clinical signs and have been doing really well. The 6th horse that did not come in for treatment because we did not think it was exposed to Rumensin, unfortunately passed away within 48 hours of exposure. So that was really definitely the worst part of the whole experience for everybody.
Yeah.
Megan, is there anything that you wish you would have known or anything you'd want other horse owners to know about this toxic
Honestly,
event?
if you have horses and cattle, I would highly encourage people to look into alternatives to Rumensin because there's a lot of them on the market now that are safe for horses. And you can be as careful as you want, and sometimes it just happens and there's nothing you can do about it. So I would highly suggest looking into alternatives to that additive.
Yeah, yeah. Rumensin and Bovatec are great feed additives for cattle whenever they're used in the right amounts. But it's really important that if you are using these products, they're stored as far away from horses as possible because any small amount can put them at risk for serious disease or even just making them unable to ride because it's unsafe. They can collapse with heart problems at any point if they are exposed to certain levels of that additive. So keeping that feed in totally separate locations where the horses can't get to it is the most important thing, but also just making sure that you know what's in the feed that you're giving your cattle or sheep or goats. You can add Rumensin or Bovatec into like a total mixed ration, or it can be added into a mineral, pellets, protein supplements. So if you see Rumensin or Bovatec on that label, make sure that you're cognizant of whether horses have any access to that at all, whether it's in a stored bag or out in a tub in a pasture especially.